Let's start with the possibility of school closures or broadly the disruption of daily life. How soon do you think that kind of thing will come? I see that Nicola Sturgeon is saying that closures of schools in Scotland is being considered. What's the sort of pan-UK thought?
Well, I think the Prime Minister is chairing another COBRA meeting today, and that's the committee that gets all the relevant bodies, relevant government departments together, talk about potential measures. Matt Hancock, the Health Secretary, made clear a couple of weeks ago that all measures that were advised would be considered. I think, of course, the impact of school closures would be enormous, not least for those, of course, many of our NHS workers and those working in social care who, and those working in supermarkets, for example, who've got children of school age, who we are expecting and hoping will be able to help everybody else, particularly the elderly, who may now be at home in order to stay out of harm's way, in order to help them, for example. So it's a really big step to close schools and has a knock-on impact. But we'll wait to see, I think, what social distancing measures are suggested.
And so that the interplay of various measures being actively considered. I know I've heard that from the scientific community. What does success look like in terms of controlling this outbreak? Is there a danger that there is a mismatch between the government giving calming words and bringing forward measures to cushion the economy and the reality of what is going to be a very difficult period for people in terms of the death toll from this and the disruption to daily life?
Well, I think the sort of slightly alarming thing, of course, for all of us is we haven't seen anything like this before. I mean, it's not totally unprecedented, but it's probably unprecedented in most of our living memories. So we haven't really experienced anything like this before, and I think most people are trying to be sensible, trying to still care about daily life. They are very focused on what's being said in Parliament and what the advice being given by the medical authorities. But I mean, the Chancellor yesterday stressed, an additional £12 billion of measures, and he stressed, as he said, and the Bank of England said, a temporary stoppage, if you like, in our economy, which is potentially going to happen. Again, this is unprecedented, but I think it's recognised that the UK government, the Bank of England response has been to get out there early and to offer that support so people know that their personal income will be helped, or their business income, should the worst happen.
If, we're seeing huge measures being taken in places like Italy, where they've closed all shops except for grocery stores and pharmacies, or, obviously we saw in China very draconian measures, in the U.S. banning travel from Europe. Have you considered, or has someone in the government considered just using a big hammer and closing all schools, shutting down the pubs, really locking down for, say, 1 month to try and weather this thing?
Well, of course, I'm not part of the discussions anymore, as I'm no longer a cabinet member, but I think everything is being considered. As the Prime Minister has said, I think there is a danger that politicians need to be seen to be acting, and actually what's got to be weighed up is, do those measures actually make a difference, or are there other things? So, for example, we've had a very well-prepared testing regime in this country with the NHS. We've had laboratories capable of testing for the virus for a number of weeks now. I remember going on TV in January and talking about that, and so those measures are in place. But as I say, I think everything will be considered. The issue, of course, is about doing it at the right moment. So what you don't want to do is to put in place draconian measures now that people have kind of run out of patience for and then not adhering to when the peak comes.
Yes, I've heard a lot from the scientific community about the timing. It's very important to get the timing right on some of these measures. Nicky, what confidence can you give us that the ambition set out by Rishi Sunak yesterday, that there is the capacity within the inner workings of government to make sure that this is really delivered to the coalface, to where it really matters very quickly? So, for example, staffing at HMRC, the banking interface with its customers, HR departments around the UK. All these parts need to very quickly get up to speed about what is being offered by the government to make sure that it's effective.
They do. And I think, funnily enough, the preparations for Brexit last year have shown that actually our civil service and then our sort of associated bodies like HMRC, like those in the banks, for example, can be brought together to act very, very swiftly. And so I think that's what we are absolutely seeing. I mean, this is the government's #1 focus. That's why the Prime Minister is going to chair, as I say, another COBRA meeting today. And I think that it's generally agreed that the responses that the Chancellor outlined yesterday, and as I say, the steps in the Bank of England, absolutely have given that boost and that confidence to. I mean, I think businesses were really worried, for example, obviously just about cash flow. If you're running a business that relies on customers coming in from the high street and they stop coming, then actually it doesn't really matter what you do. You just need help to get that cash in so you can carry on paying people, particularly if they're also sick, for example. It makes a difference. Will make a difference.
Just briefly, Nicky, if there is a suggestion that people should work from home, I mean, how likely is the House of Lords to be able to work from home?
Well, I mean, I think what Matt Hancock rightly said last night is that Parliament will continue to sit. I mean, again, obviously we have to be guided by the evidence, but I think it's really important that parliamentarians are able to scrutinise. However, there will be members, as we've seen, of the House of Commons, House of Lords, who will decide for their own health, of the health of others, that they should stay away, and I think that's right to do.